peptic ulcer disease. People just give themselves that diagnosis without actually going to see a doctor, doing any tests to make that diagnosis. So you just say, pain, no, it must be ulcer. And the moment they mention ulcer, they go to a chemist and start taking medications. Yeah, so what is peptic ulcer disease? It's a broad name that we give to ulcers in the alimentary canal, that is the throat, the neck, the esophagus, the stomach, the intestine, the small intestine. By the time you're having ulcers in your large intestine, they are no more, we don't call them peptic ulcer anymore. They have their own names. They have names like irritable bowel syndrome, ulcerative colitis, Crohn's disease. But when you have ulcers in the lower part of the esophagus, in the stomach, in the beginning part of the small intestine, that is the duodenum and the jejunum, we say they are peptic ulcer disease. So this is a group name. There's gastric ulcers. Gastrum is stomach, is the Latin name for stomach. Duodenum is the first part of the intestine. The jejunum is the second part of the intestine. So everything, ulcers that occur from the lower part of the esophagus down to the first few centimeters of the small intestine, we say gastric, we say peptic ulcer, we just call them generally. Now, what is an ulcer? An ulcer is a breach, a break, a tearing or wearing off of the layer of the lining of any tissue, of the inside of any tissue, or the surface of any tissue. When I say tissue, I'm talking about a group of cells that perform the same function. So your liver is a tissue, your intestine is a tissue, your skin is a tissue. So when I say breaking apart, so every tissue has its border, has its barrier, has its covering. Your stomach is a tissue. It is lined by cells forming different layers, the muscle layer, the secretory layer that produces chemicals, the absorbing layer that absorbs whatever you eat. The same thing with your intestine, the same thing with your skin. So the presence of layers form the tissue. So in the case of ulcers, we say that an ulcer is a break in the continuity of that lining of the tissue. And in the case of peptic ulcers, because we have ulcers everywhere in the body, you can have skin ulcers. There are people that have diabetes. There are people that have sickle cell disease. They can have skin ulcers. There are people that have some degenerative skin diseases. Now, in the case of the stomach and the intestine, in the case of peptic ulcers, what causes these layers to break? It is an overproduction of acid. The same acid that your body needs to break down food, or you had a piece of a slice of pizza, your body produces acid to break it down. Or I had some eggs, I had some meat, I had some rice, I had some vegetables. Your body produces acid to break down the food that you've eaten. Now, in case of ulcers, the production of this acid is so much that it begins to damage the tissue itself, the wall of the tissue itself. So when I eat food, there are hormones released, there are triggers released that tell me, oh, there's food in my stomach. And when the food is digested, another signal will say, look, stop producing chemicals. The food has been digested. There's no need to produce chemical anymore. For in case of people that have ulcers, that mechanism, that system of signal on, signal off is affected, is damaged. So once the signal on that is producing of acid, the body does not know when to stop producing the acid. And now, if there's no food for the acid to digest, the acid starts digesting or breaking down the wall of the stomach, for instance. And that results in pain. Some people may vomit blood. Some people may pass blood in their stool. Some people may have stomach pain, some people may feel dizzy, some people may even throw up. All this can be as a result of the ulcer. Now, what are those things that can trigger or cause an ulcer? Number one, bacterial infection. I'm sure many of us have heard of H. pylori. Bacterial infection, this particular H. pylori triggers the system and breaks that signal on, signal off in the stomach and allows acid to be produced more than what the body needs. Allows acid to be produced even when there's no food to be digested. Another thing is stress. Physical stress, emotional stress, hunger stress, malnutrition stress, eating the wrong kind of food kind of stress, alcohol stress. So I was saying bacteria, Helicobacter pylori, can cause ulcers. You can get that from your poor diet, unhygienic eating habits, unwashed fruits, uncovered or exposed foods, poor hand washing, not choosing a clean eating outlet, restaurants, and the rest of them. Stress from alcohol, from poor diets, from uncontrollably spicy or ridiculously spicy meals, fasting, malnutrition, smoking could give you ulcers. And of course, ulcers. It is believed that some people of some particular blood groups are more likely to have ulcers than others. I learned that in school, but I've not really found materials to support that thing that, okay, people that have A positive blood group are more likely to have ulcers, and people that have O positive blood groups. So that's a bit vague for me. So I'm not going to be talking much about that. So fasting, smoking, illicit drug use or overuse of non-steroidal anti-inflammatories. So we have the commonest one of them is aspirin. So overuse of aspirin, especially for people that, number one, actually take it for maybe blood clot problems, or people that just take it for pain relief problems randomly. So they overuse it. So what it does is that it tips that balance between the acids that digest food and the base that dilutes the acid when the digestion is done. So that imbalance can be caused by certain medications, painkillers, can be caused by alcohol, smoking, fasting, eating spicy foods, can be caused by bacteria. Now that we know what causes it, how does it actually occur? We said before that there's a balance between the acid that causes digestion in the stomach and the base that dilutes the acid when digestion is done. All is controlled by nervous impulses. The brain controls everything. Now, the moment that balance is off, the body produces acid when there's no food to trigger. So that acid now goes to the wall of the stomach. And because the acid is designed to break down carbohydrates, it's designed to break down proteins, designed to break down some fat. These are the components of the human tissue also. So it goes on the lining of the wall of the stomach and starts eating up the wall of the stomach and of the intestine. So that barrier that occurs between your intestines, insides, and the outer part is now broken. Exposes nerve endings, so there'll be pain. Exposes blood vessels, so there'll be bleeding. Exposes the unprotected layer. This will now create a sore, a wound in the stomach. This wound in the stomach is what we now call the ulcer. Because so long as the wound exists, you're drinking water, you're eating food, you are taking coffee, you are taking medications, all these things rub on the wall of the wound and to slow down its healing process. And of course, the acid is still being produced. So the eating up of the wall continues. And in some severe cases, it can actually perforate. So we now say we have perforated peptic ulcer. That is, the ulcer has eaten up to the point that it has created a hole to now go into the abdomen. Unfortunately, this is an emergency because it's not the kind of pain that will say, oh, I just have a little pain. It will be a terrible, excruciating pain to now make it puncture because acid from the stomach now go to the intestine to pick up the fat in the intestine, to pick up the tissues, other tissues in the intestine, the intestines lining, the fat outside the intestine, outside the stomach. All this will cause severe pain and usually needs emergency surgery. What are the symptoms? Number one, there will be pain. Pain from exposed and damaged lining of the cells of the stomach and intestine. Pain from having acid, just like having pouring acid on your skin, eating up the insides. This pain is usually described as if it's a chest pain because in the stomach, you feel like it's like heartburn. Because the stomach is in discomfort. The stomach will try to throw out whatever is inside. So we have regurgitation. We call it reflux. Reflux is that your stomach, what is in your stomach already, tries to go back up. Should I get a board? A drawing board so I draw what I'm describing. The tongue. The intestine. We don't need to bother about this part. So this is what I'm talking about. You eat your food. It goes down. There's a little, we call it a sphincter, like a little door that keeps food from going back in the opposite direction. So this is the stomach. At the linings of the stomach and this part, there are cells that help to digest food all over the lining of the stomach like this. They help to digest and absorb food. And of course, anyone will know that so many tiny blood vessels are connected to the stomach, to the liver, to the body. They help supply blood supply to the liver, to the intestine, and take away some of these nutrients from the food you've digested. Form connections like web connections that number one, they bring nutrition. I said before that there's a mechanism that tells the body, oh, there's food in the stomach. Start producing acid from the wall to digest the food. Start producing acid to digest the food. And when the food is digested, another thing from the brain tells the body, stop producing acid. That's how it works normally. There's food in the stomach, the brain says there's food, you start digesting. Once the food has stopped, brain tells the stomach, no more food, stop digesting. Now, I said there are some things that can stop this control. Number one is the Helicobacter. Pylori. Sometimes, many times they will say H. pylori. You just see them, you just write H. pylori. H. pylori. You'll say H. pylori, H. pylori. It's a bacteria that can be gotten from poor hygiene, unwashed fruits, poor handling of foods, and the rest. You can get it from your people that don't like cooking their meat completely. We hear things like medium rare. Also, you can get this mechanism, this pathway can be disturbed by stress. Stress from alcohol, stress from emotions, stress from fasting, stress from spices. What else? What else? What else? What else? Yes. Stress from smoking. And so many things that we put into our stomach can cause stress. This can cause ulcers to be formed and affect this mechanism. What else did I say can cause? What else did I say can cause ulcers? I said non-steroidals. This is non-steroidal anti-inflammatory drugs. We have many of them. The most common of them is aspirin. Aspirin, ibuprofen, diclofenac, naproxen. There are so many. When they are taken out of context, that is excess, you're not waiting for prescriptions or you're done with it because the doctor said you should take it for pain relief. Anytime you have pain relief, that's your go-to. You don't bother consulting your doctor anymore. Just use them uncontrolled. That can cause these mechanisms to be disrupted. Now, what exactly goes on at the level of the intestine, or the level of the cells? Because we've seen, okay, this is how the stomach operates. This is how it looks. This is how it works normally. I'm going to give you an example of, let's assume that this little portion here, I bring it out here. This is the outside, the blood supply. There are layers, the smooth muscle layer. Then inside, what actually goes on inside is like this. This is how the inside, the lining of the stomach and the intestine looks like. I'm enlarging this one to let you see what actually goes on inside. So, in this layer, this muscle layer, that's what helps the stomach open and expand and contract. When you have food there, it expands and you get to a point you feel that you are full. And it tells you, okay, let me stop eating, I'm full already. And it contracts and say, oh, my stomach is spinning me, oh, I'm having hunger pangs. It contracts. So this layer is what's responsible for that. This inner layer. This outer layer is the covering, is the protection. On the outside, it takes blood vessels in and out. Arteries come in, veins go out. What do? They bring in oxygen, nutrition for the muscles, oxygen, nutrition for the cells, and they also take out digested food. So, digested food goes out, oxygen and energy comes in. Every living thing needs energy, every living thing needs oxygen. So now, still at the level of this, I'm going to enlarge this a bit. So you actually see what happens at this level. You have your outer layer, you have the middle layer, and you have the layer that contains crypts, like I don't want to use any technical word, but they're like pits. They're like pits. What happens in these pits? You have cells lining in each of these things that looks like like grass, like filaments, like fibers. What do these cells do? These cells are the ones that produce chemicals that helps your stomach digest. So one of them is gastrin. One of them is hydrochloric acid. You talk about renin and pepsin and the rest, but there are so many. And what these do is that they help to digest. They help to digest your sugar, your food. They break down your sugars into glucose, sucrose, fructose, whatever kind of sugar you take. If it's milk, it break it into lactose, sucrose. If it's yam you eat, to break it into glucose. Just like that, keeps on breaking down. And like I said, the brain controls this process. The brain tells you, okay, there's food in the stomach because the muscles are stretching. This stretch will go to the brain, and the brain records it like, oh, there's activity, there's food in the stomach. What the brain now does is that it sends a signal like to these cells, start producing digestive enzymes. When the digestive enzymes are produced, they break down the food into sugar that are now absorbed through the blood vessels to the liver, then to the rest of the body. Hope everyone understands that. Now, the presence of these triggers, 1, 2, 3. Ibuprofen. I give example of diclofenac. They all fall in the same class broadly. Can trigger ulcers and affect how much of this acid is produced. This lining that I drew before, I just made it bigger. You're assuming that this is the lining of your stomach. Okay, Dunia. This is the stretchy part. And this is the muscle part. This is the stretchy part. This is the part that actually contains cells. Cells that produce the digestive enzymes and the rest. Cells that actually absorb what is broken down. I said that gastrin is here. Hydrochloric acid is produced from here. When this hydrochloric acid especially becomes too much, then there's no more food. There was food here before. It's broken down, it's been absorbed through the blood vessels to the liver, to the body. You get energy, you're rejuvenated, you can get energy to whatever you want to do. What now happens is that this space that you have, let's say here now. Let's just create a space for it here. Here. Now begins to, this acid now, because there's no food for it to digest, now begins to break down the proteins. Now creates what you call an ulcer. This is where food is. This is what the normal cells look like. These are the normal ones. This acid now, there's no food, now begins to break down these cells, now creates a gap. Now you have blood vessels here, you have nerve endings here, part of the muscles has been broken through. Part of the muscles have been broken through. Part of the stretchy part of it has been broken through. And this is what an ulcer is. So if you eat spicy food, you have heartburn, because now the protective layer, this is supposed to be a protective layer, has been eaten up here. So there's no protection anymore. You're having heartburn. This pain sometimes can be felt at the back. So the person says, oh, I have chest pain, and sometimes I feel it at the back. It's because of the way the nerves have supplied the stomach. So that pain is also felt at the back. I feel like I want to vomit, I want to throw up. Because blood is now seeping into the stomach. This blood is now irritating the stomach. It's not supposed to have blood in it. So blood is now seeping from exposed blood vessels into the stomach. So this person is now feeling like throwing up, and sometimes even vomits blood, depends on how severe it is. This person has abdominal discomfort. There's blood in your stomach. You're not supposed to have fresh blood there. This person may have dark colors too, because when the blood goes down and gets digested, changes color and becomes dark. We are going to the treatment now. So your treatment, what do you plan to achieve in your treatment? You want to, one, reduce acid production. That's number one, because that's what's really causing it. Number two, you want a healing to go on. You want to heal the ulcer. Those are the two things. And you want to manage symptoms or complications. So number one, you need to manage the pain. So pain control, complications, other pain reliefs that will not give you ulcer. Your regular cocodamol, you guys in the UK use cocodamol. Your regular Tylenol, if you're in the US, will help to manage the pain. Reduce acid production. There are many medications and they act in different ways. How do you reduce acid production? Number one, you can dilute the acid. Your antacids, your milk of magnesia, your gascol, whatever name they call it, will help to dilute the acid. And of course, when the acid is diluted, the damage is reduced. There are other drugs that they give you that would stop or reduce the acid production. They have so many names. Why water will not work is that water will only make it a bit less acidic. It's still going to be acidic. That's why we need something that has active components that will counter what the acid is doing. One of the things that is readily available to is milk. Milk, yogurt. Those ones will readily counter. Yes, they may not be as effective as your gascol and the rest, but they have a stronger effect or a quicker effect than just saying, oh, let me go and drink water. So if it's a certain thing, milk on the steady, yogurt on the ready can help. But your antacid tablets are better. What else are you looking for? You're looking to heal the ulcer. And what happens? Because the body is the body is designed to heal itself naturally. Once there's no trigger, where are my triggers? Once there's no trigger, yeah, we'll come back to this diagram now. Once there's no trigger, the body gradually, just it's less like healing a wound. We gradually fill it in. We gradually fill it in, and those cells will come back gradually. So long as the damage is not continuous and what is causing the damage has been reduced. Another way we can control the acid production is antibiotics. Remember we said the first cause I will put up was H. pylori. I will take that question. H. pylori is a bacteria, and usually they will tell you to do a urea breath test because this bacteria releases urea that sometimes shows up in your breath. So you can do a breath test to see if it's positive. That means it's likely that you have this bacteria, and it will give you antibiotics for a duration to make sure that this bacteria is eradicated so that it doesn't trigger this whole process all over again. Now, the issue of apple cider. Is apple cider acidic or basic? Is vinegar acidic or basic? These are the questions you need to know. If they are acidic, it is going to contribute to this problem. If vinegar is acidic, it's going to contribute to this problem and worsen it. So I'm only talking medical, proven, documented management of ulcer. I don't know what contains, what pH vinegar is or apple cider is. I know they are produced by fermentation of seeds. Salt will not help. Remember that this is an injury, it's a wound, only that it occurs on the inside. How do you feel when you put salt on your wound, on your leg? There's a reason why there's a saying, adding salt to injury. It only worsen it. It will not help. So, when you do the test, they give you antibiotics, and they see that you've solved the problem. Now, you have to wait for the body. Eating healthy, washing your fruits before eating it, taking enough rest, avoiding alcohol and smoking. So if it's acidic, it will not help with this. So, resting, taking enough proteins so that your body can fill up the gap and you can have a normal, what we call a normal mucosa. So this gap, it's now filled up back to what used to be before, and your muscle layer is developed. Now, Dunia, you asked that how long does it take? Healing varies from individuals. Because this is a wet wound, this is what we call a wet wound. You're swallowing saliva, you're eating food, you're drinking water, everything flows against the surface. So you're going to take a longer time to heal than a dry wound, like a wound on your skin. So, if you follow medications and you adhere to treatment, you can get full healing within 2 years. You can get properly healed and properly treated within 2 years. If you follow procedure, because you can't say the person should not eat, how the person get nutrition. You cannot say the person should not drink water. There's no way to prevent all this food and everything from washing against the injured surface. So by 2 years, we say, look, you follow treatment. By 2 years, you've reduced your drugs to the barest minimum and you are healed. Now, let's talk about complications. Refuses to use medication. Oh, it's my family's culture to eat spicy food. I cannot help it. There's nothing I can do. Everyone eats spicy food. I love my spicy foods. I love my cheesy foods. I love my fatty foods. I cannot help it. What are the complications that are likely to happen from peptic ulcer? Number one, perforation. Perforation. That is, the lining has been eaten up to the point where it actually bursts through the stomach or the intestinal wall. So all the food contents, the chemicals, the acid goes into the abdominal cavity. There's going to be severe pain. Some people may even faint. There may be chest pain, there may be cramps, difficulty in breathing, all associated with the pain. If it goes on untreated, there may be loss of life. It can damage other organs, other organ damage. Remember that this is hydrochloric acid. This is the same acid that used to melt or dissolve metals. This is how potent it is. So if that touches the liver, for instance, it's going to eat up the liver and cause liver damage. Touches the other parts of the intestine, it's going to cause perforation along different parts. What we call peritonitis. You're going to pick up the fat that covers the intestine and cause pain there also. That's just number one. Perforation. Number two, there can be reflux. What do I mean by reflux? Where's my by reflux, I mean, remember the first diagram that I drew of the stomach? The very first diagram I drew, I said this is the mouth coming down to the esophagus. I said up here, there's a little door. We call it a sphincter. It's a natural door that keeps food from going opposite direction. So, and the cells here are quite strong to take the concentration of the acid. But here, they are not quite strong. Their main function is not absorption, it's just to allow food pass. And sometimes cool down the food that is coming down to your stomach. So, if the acid goes in the opposite direction, number one, it's not properly digested. Number two, it's having acid content. Number three, it may have blood or other things. The reflux will cause what you call heartburn. It will cause what you call heartburn. Why is it called heartburn? Because it feels like it's right in my chest. Because of course the esophagus comes this way. So when it's burning, it feels like chest pain. So they'll tell you I have chest pain anytime I eat spicy food, or I have chest pain anytime I drink alcohol too much, or I have chest pain. It's not actually as a result of the heart. It feels like a burning feeling because the esophagus passes close to the heart. It passes close to the heart from the mouth. It passes down to the stomach. The heart is somewhere here. The lungs are somewhere here. So it feels like it's actually your heart, but it's not your heart. So there'll be heartburn. And if care is not taken, the cells here will start changing because now they're having something that wasn't there before and can lead to, a lot of people don't want to hear this word, cancer, either in the esophagus or in the stomach. So Complications: perforation, death, organ damage, reflux, heartburn, cancer. It's not just the stomach that can perforate. The duodenum, the first part of the intestine, can perforate. The jejunum, the second part, can perforate also. And once this perforation is done, all these things can happen. The third thing that can happen, a third complication, is indigestion. That's the third thing that can happen because some of the lining has been damaged. So you're having less cells to digest your food. And what will indigestion give you? It will give you bloating. Some people say I have gas. It will give you bloating. It will give you abdominal pains or discomfort or cramps. It will give you either diarrhea or constipation. I hope we know the difference. I hope we know the difference between constipation and diarrhea. Diarrhea is when you're having too much watery stool. Constipation is if the stool is not even passing at all. The bulky stool, you're having problem passing it out. Another complication that can occur is, I don't want to use any technical name, but it's basically blood in the stool, either in the vomiting, or in the stool. So we are having bleeding from the walls of the intestine, the walls of the stomach. You're having blood here. You could see it in vomit. You can see it in the stool. How do you know there's blood in the stool? Because it's up in the stomach. Some of the blood would have gone through changes. There will be dark stool. We usually call it dark tarry stool. The stool will be dark, like deep brown to black colored, because of the iron that has been, the iron from the blood, some enzymes that are acted on the blood. You will see bright red blood in vomiting, in the vomit. It may be streaks, it may be actual clots. And how do you okay, so we've done vomiting, stool. We've also talked about the treatment. Medications can make the stool, but depends on the kind of medication. If I'm taking iron tablets, I will notice the stool be dark. If I'm taking iron tablets, my stool is going to be dark. If I'm taking, so iron tablets, most of your blood tonics, your pigments of your capsules will make the stool dark. But now, when I talk about dark stool, you're talking about the symptoms: abdominal pain, abdominal discomfort, back pain, chest burns, indigestion, bloating, all this coming together with dark stools. Of course, I will not say it's medication that causes that one. Because of the other symptoms, I'll say, okay, it's likely to be as a result of the ulcer and the complication of the ulcer. So with all I've explained, we've explained how to manage it. I have tried not to mention any drugs, but this is basically what we go through in the management. Once you reduce the acid production, there are drugs that act on the cells that produce the acid. I'll not be mentioning any name of any of those drugs. You're going to see your doctors to see that. They are medications that you drink or you eat or you swallow, you chew, that you dilute the acid and you stop the acid production. You want to manage the symptoms, pain relief. If it was pain relief that costs you, if it was those painkillers that cost you ulcer, I'm not expecting you to go and be taking those pain relief medications because you want to treat the ulcer again, because they will still cause triggers. The complications, person having bleeding, you want to investigate, you want to do tests, you want to do scans, you want to do x-rays, whatever, to find out where's the bleeding come from, where's the bleeding, is there perforation, can it be closed? Then you want to allow the ulcer to heal. Protein diet, eating healthy, your fruits, your celery, your vegetables, your pumpkin, whatever you eat, make sure it's clean, washed. You want to give antibiotics if you find out that it was H. pylori that is causing the ulcer. Give antibiotics and do a test after to make sure that the antibiotics was actually effective. You want to also do modification of your lifestyle, alcohol intake, smoking, what is causing you stress emotionally, physically. Want to modify those things so that you stop it. Yeah, hygiene. You need to wash your hands, you need to wash your fruits and vegetables. So with this, I've basically talked about peptic ulcer, but I don't know if you have questions. We've come to the end of talking ulcer, peptic ulcer diseases. Thank you everyone for watching.